Good afternoon, everyone. Thanks for joining us today for our LIS Extra Help and LI-NET presentation and update training. For those of you in Live Monwash, you should know who I am. I'm Melissa. We've got Bev and Loretta also on here, so Oakland County Site Coordinator, and then the St. Clair and Macomb County Site Coordinator as well. We are going to get started here in about 5 minutes. In the meantime, you should have access to 5 handouts if you didn't get them already through email. So you can grab those from the handout section of the GoToWebinar. If you are on a phone or a tablet, that may be trickier. You might not have access to the handouts, but if you're on a computer, you should be able to snag that. And we will do some housekeeping and intros here in about 5 minutes when we get started.
And if you can't snag the handouts, don't hesitate to email your site coordinator and we'll send them to you.
Dave, you had a question? Dave Cook, did you have a question for us? Dave, I see your hand raised. If you have a question for us, let us know. I don't currently see, though, that you have a microphone connected. So maybe you need to connect some audio.
Put the question in the chat box.
Yep, and you can also put your questions into the chat box if you've got some. Got some more folks signed up on right now, so just a real quick, we're going to get started here in just a couple minutes. We're going to let everybody else hop on. Those of you who know me, I'm Melissa Devine, Site Coordinator for Livingston, Washtenaw, Monroe County. We have Loretta Mack from Oakland County and Beth Clark with St. Clair and Macomb County. We're going to do an intro and some housekeeping here in just a few once we've got everybody on. And just a reminder, this is a recorded presentation for you guys. All right, well, good afternoon, everybody. I'm sure we'll have some people logging in as we go forward, but thank you so much for joining us today for our LIS LI-NET update training. Again, my name is Melissa Devine. I am the site coordinator for Livingston, Washtenaw, Monroe County. We have Loretta Mack, who is the site coordinator for Oakland County, and Bev Clark, site coordinator for St. Clair and Macomb County. Some quick housekeeping for you guys. We are going to request that you save questions till the end of our training. And if you'd like, you can type your question into the chat or the questions box on the webinar. But we are going to go through both topics before we address questions instead of individual questions for topics. This is a recorded presentation, so if you want to save your questions till the end and have us stop recording, we certainly can. And yeah, we'll go from there. You should also have access to 5 handouts. They are in the handouts section of your GoToWebinar. If you do not have access to those right now, do not panic. We can get you copies of those handouts. You just reach out to your site coordinator for more info on it. All right, so let's get started. I'm going to shut my camera off so that I can focus on this PowerPoint here. All right, so we're going to get started with the LIS Extra Help program. I have a couple of questions for you all, if you don't mind joining our poll today. Before we delve deep into the LIS situation here, I want to see what you guys know. So here's our first question. Who determines eligibility for LIS applications? You have the choice of CMS, Social Security, or Michigan's Department of Health and Human Services, MDHHS. Give it a few more seconds here. Give you guys a chance to answer. All right. All right. We've got about 92% voted, which is awesome. All right, so I am going to close this poll up here in just a few seconds. And all right, so out of those that voted, we had 74% answer Social Security or SSA, and 26 said Michigan's Department of Health and Human Services, MDHHS. The correct answer is Social Security. They are the ones who determine eligibility for the LIS Extra Help program. All right, I got another one here for us. What does LIS help with? So take a minute here and answer this one for us. Man, you guys rock. I love seeing this. Give it a few more seconds. Looks like we've got almost everybody here who's taking a minute to answer. Awesome. All right, so I'm going to go ahead and close this poll. And 88% of you guys answered the Medicare Part D monthly premium deductibles and copays, which is the correct answer. The LIS Extra Help program does help with Medicare Part D monthly premium deductibles and copays. All right, and then this is the last poll, I promise. I want to see what you guys know in regards to what LIS stands for. What does the acronym LIS stand for? Lunch in Seattle, Lucy is Silly, or the Low Income Subsidy? You guys are awesome. All right, we've got the bulk of the answers for here, so I'm going to go ahead and close this poll up. You know, we had to start our presentation after the poll with a really funny question. So, all right, so let's go ahead and get started here. Again, thank you guys so much for joining us for the LIS Extra Help and LI-NET update training. Today, if I can get my mouse here, it'll pop up. There we are. We are going to talk first about LIS and Extra Help. So for our LIS Extra Help portion of the presentation, we are going to cover the benefits of the program, who the key players are, eligibility rules, the income and asset testing, and of course the important parts of how to apply. Any tips for applying? Tips for applying, determinations, appeals, and step-by-step guidance on application process. So let's get started with help on Medicare prescription drugs, the Extra Help and Low Income Subsidy. So why LIS and Extra Help matters? LIS and Extra Help matters because it helps with the cost of Medicare Part D. Medicare Part D drug plans can add up. There is the Part D plan premium, deductibles, and of course prescription drug co-payments and co-insurance. And depending on the medication that the beneficiary takes, that could be the difference between a roof over their head, a meal, and getting medications that they need. Poverty among the Medicare population is at nearly half. That's 47% or 25 million that have an income under 200,000% of the federal poverty level. Many of those individuals are likely eligible for the LIS Extra Help program. On average, the value of LIS for the eligible individual saves them $5,000 a year. More benefits to the Extra Help LIS program is that LIS allows beneficiaries to access their prescription coverage. Without the program, many low-income seniors will forego their Part D coverage and they won't take medications that are necessary for them to remain healthy. Specifically, Extra Help protects people from the Part D coverage gap. It'll waive any late enrollment penalties for their monthly premium. And it allows them a continuous special enrollment period. It allows them to change their plans once every 3 months, although we don't necessarily recommend that. But if they need to get into a different plan to better serve them and their healthcare needs, they have the opportunity to do so. they wouldn't have to wait until the next open enrollment period to change their plan coverage. So who are the key federal players? Like our poll that we took earlier, Social Security and CMS work together to help administer and educate the public about LIS and Extra Help. Social Security is the one who handles the applications and the eligibility determination. And CMS is going to handle the Part D plan assignment for those that are eligible, and of course, coordinate the subsidies to those Part D plans for the eligible enrollees. Now, if you're ever in doubt, there are some ways to determine whether somebody is going to qualify for LIS, but there are certain eligibility rules, much like any subsidy program. The person must have Medicare Parts A and or B. If you remember, the access to Medicare Part D only requires having one or the other in terms of Part A and or B, or they can have both Medicare Part A and B. So they also must live in the United States. They must meet the financial eligibility criteria. So that's the income and asset test, which is based off of the annual federal poverty levels. And for those who might automatically qualify for LIS, there is going to be some information that's utilized to make sure that they meet that. But once they're eligible, all of those who get LIS will have it for at least the remainder of the year. So again, if ever in doubt when you're counseling a beneficiary, you can look to your yellow color job aid, that's the yellow sheet, and check to see if they're within that income and asset eligibility criteria, and even utilize the Preparing to Find Out If You Qualify tool, which Loretta will show us more on here in just a bit. So LIS Extra Help eligibility rules. There are some groups that automatically get LIS or Extra Help. That would be those that are full benefit dual eligible, so they have access to Medicare and Medicaid. There are those that have the Supplemental Security Income or SSI, and that would be including also the SSI recipients who do not qualify for Medicaid, but these individuals are deemed to be SSI recipients. And then there's also those Medicare beneficiaries who participate in the Medicare Savings Program, the MSPs. So that would be Quimby, Slimby, and Omby. Now, deemed eligibles do not need to file an application for the subsidy. CMS will automatically award them the subsidy based on information received from the state and Social Security and notify them that they are eligible without having to file the application. They will, however, need to choose a prescription drug plan. The full benefit dual eligibles who fail to choose a plan will be enrolled by CMS in a plan effective the month that they attain dual status. So Quimby, Slimby, and Omby SSI recipients and others who apply and are found eligible for the subsidy will be enrolled in a plan by CMS if they do not choose a plan on their own. There are two levels of help from LIS. You've got the full help or full subsidy. That's for those with lower incomes and fewer resources. And then you have the partial help or partial subsidy, and that's for those with slightly higher incomes and resources. Now, these two levels are different from those who automatically are eligible for LIS because these are for those that are not necessarily SSI recipients or Medicaid dual eligibles or MSP participants. With both full and partial help, this will help eliminate the Part D coverage gap. It also will eliminate that late enrollment penalty that's tacked onto their monthly premium. And here is a quick look at what the yellow sheet looks like. Okay, so for those that are Medicaid eligible, that's those dual eligible beneficiaries that automatically qualify for LIS. They have a lower income and asset bracket that they would need to meet. Again, these are going to be folks that automatically qualify for it though. You can see though that their benefits is that they have no monthly premium as long as they're within that, I believe it's a $32 range this year. There's also no deductible for their Medicare Part D plans. And their costs for their medications are anywhere from $1.30 to $4, depending on whether it's a generic or brand. If you happen to encounter somebody who's not automatically eligible because of their dual eligible status, and they fall within the full help, that means that they are within that minimum of $1,469, I'm sorry, yes, minimum of $1,469 per month income. That is gross income, and that is for a single individual. And then their minimum assets are $9,470. If they are within that full health category, they will also have no premium monthly if they're within that $32 range, and no deductible for their Part D coverage. Their medication costs will run from $3.70 to $9.20 per med, depending on whether it's generic or brand. For those that might be above that $1,469 monthly income range, the partial help allows folks to be no more than $1,630 per month in their gross income, with no more than $14,790 in assets. Again, that's for a single individual. It will be a sliding scale monthly premium. They will have a $92 deductible, and they will have a 15% coinsurance on their medications until they've met their true out-of-pocket threshold, or the TROOP. For the true out-of-pocket threshold in 2021, that is $6,550. Once they've met that true out-of-pocket threshold, their copays then will reduce from the 15% copay to $3.70 or $9.20, anywhere in between, depending on generic or brand medications. Again, you can view all of this information in more depth on the yellow color job aid, or the yellow sheet. And of course, any changes to the federal poverty level are going to take place yearly in January, typically January no later than February. So when our numbers are updated, that will change for the following year at the beginning of the year. So we're going to look at what the income test looks like. So countable income can include Social Security benefits, retirement, SSI, railroad retirement benefits, pensions and annuities, wages, which is going to be gross, or earnings from self-employment, which is net. There is a small portion of your earned income that is not going to be counted. They will count alimony, rental income, and workers' compensation. The excluded income includes any SNAP, so food stamp benefits that they receive, any fuel assistance benefits they receive. Here's the portion of the earned income that's not counted. It's a $20 monthly in unearned income, such as Social Security, and then work-related expenses for people who get Social Security benefits for a disability or blindness. Now, there are going to be some examples where the income can be higher and you can still get extra help. That's going to include if somebody is married, or if they support other family members that live with them and have other earnings from work. We're going to take a look here at the resource test. This is the asset portion. Countable assets include financial institution accounts. So they need to know what their checking, savings, CDs, all of that information is. Of course, any cash that they may have at home, stocks, bonds, IRAs, 401ks, any real estate, so equity value that they might have in anything other than their primary home, and certain trusts that are going to allow a person to revoke or have direct use of funds. There are certain resources that are not included. That would be, of course, the home the applicant lives in, any vehicles, household goods, furnishings, personal effects like their jewelry, maybe their fur coat, any cash surrender value of a life insurance policy, in-kind support, so non-cash help from a shelter, and irrevocable burial trusts or burial contracts. So how do we apply for LIS Extra Help Assistance? Well, we highly recommend that you utilize the online Social Security website application. It's available in English and Spanish. It's available at their website on socialsecurity.gov, or ssa.gov, and they accept electronic signature to complete the application. We will look a little closer at that online application here in just a few, but there is also access to a paper application. You would want to contact Social Security to get that paper application for someone. Do not use a photocopy of the form from Social Security. They will get it to them through mail, or they can pick one up at their local Social Security office. But once the application is completed, Social Security will make a determination, usually within 3 weeks of a completed application, and send that decision letter to the applicant. Now, with COVID in place and all of the craziness that's been happening over the past, 2 years, Social Security may be a smidge behind. They were a little bit behind when it came to Medicare enrollments as well. So if it takes a little longer than 3 weeks, don't panic. I would just maybe make a note to let the beneficiaries know that it could take a little bit longer, but typically is within 3 weeks. So tips for applying for LIS. Again, the online application is usually the easiest and the fastest. However, the beneficiary will need to create a mysocialsecurity.gov account. There's no document proofs needed for either the online or the paper application. Social Security will use federal records to verify their answers. If the paper form is incomplete, Social Security will follow up via phone with the applicant themselves. An online application cannot be submitted unless it's completed. And filling an application for LIS Extra Help online allows you to start an application for MSP for someone as well. You can elect to send the information over to the Department of Health and Human Services for MSP or Medicaid access. You also can elect not to by checking the box. Again, that is something that we are going to see here in just a bit. Also, for purposes of establishing the applicable income standard only, following persons can be counted in a family size. A single individual is going to be the applicant only. Married means the applicant's spouse, if living, is part of that process. And then married with family. That's the applicant, their spouse, and any persons who are related by blood, marriage, or adoption and are living with the applicant and spouse and are a dependent on the applicant and or spouse for at least half of their financial support. The applicant's income tax records are going to be very useful for determining who's been considered a dependent relative in the past. But be aware that IRS does not require the dependent's family member to live with the applicant, while the subsidy family size criteria does. So for eligibility review, the review is done by Social Security, typically every year at the end of August. However, again, with the pandemic protocols in place, this may not be as frequent or as quickly as it normally would have been. And if the beneficiary is not selected for review, then there's going to be no change to their assistance levels. But if they're selected for review and anything is different financially for them, they may see a change in assistance level. A review of status is done through the form SSA 1026. It does take 30 days to complete and return the form, and any updates or changes will be effective January the following year. Not sending in the form will result in a loss of benefit coverage, similar to Department of Health and Human Services. Now, if for any reason there is a review of status and the beneficiary receives a determination that they don't agree with, they certainly can file an appeal. This is an example of the appeal form. So, what can we do if a beneficiary disagrees with the information used to determine their eligibility? We want to advise them to fill out an appeal form. They can ask Social Security for it. They'll get it to them. It's form SSA 1021. They can fill it all out, send it back. They would send it to the address listed here on the slide, which is Social Security Administration, Wilkes-Barre Direct Operations Center. and they're going to want to make sure that they fill it out completely, send it back with any documentation or proof that they need to support their appeal. And then they will get the appeal processed. Social Security will get that processed and sent back to them with a final determination. Now, the beneficiary has 60 days from the date that they receive notice telling them about SSA's decision to request the appeal. So if they are past that 60-day time frame, they may not be able to appeal, but rather create a new application. Now, if the appeal determination comes back and they still don't agree with that, their next step is going to be filing a lawsuit in federal district court. That is not something that we will really advise on because we don't have that information as we're not lawyers. But the letter from Social Security does alert the beneficiary to this information and tell them how they can ask a court to look at their case. All right, so I am going to mute myself. And Loretta Mack, our Oakland site coordinator, is going to take us on a step-by-step tutorial for assistance application.
Can you hear me, Melissa?
You sure can.
Okay, just wanted to check to be sure. I'm going to take you through some of the screens you'll see if you're helping someone apply for Extra Help / LIS online. Just I will make a note that the information that you will see in the application is totally fictitious. So we just made it up as we went along. This is the first screen you'll see as you navigate to ssa.gov on your web browser and click on Menu, then Online Services, and you'll find the Extra Help link under the Medicare topic that reads Apply for Help with Medicare Prescription Drug Plan Costs. There are lots of ways that you can get to the Extra Help application, but I'm always on the Online Services screen, so I've just bookmarked it. Next. Here you can click on Apply Online for Extra Help. You can also apply over the phone or request a paper application by calling Social Security. Next page. This lists the criteria for receiving Extra Help. Note that you don't need to apply if you're receiving SSI and Medicare or Medicare and Medicaid, but the applicant should have this information available. You click on Apply Now if this is a new application, or if you have a re-entry number because you've been here before, you can return to an existing application, and we'll show you where you get the re-entry number later. Next page. This lists the documents that the beneficiary should have available prior to applying for Extra Help. You may have to submit these documents to SSA if they request them. So you should have the applicant's Social Security card, bank statements, IRA statements, tax returns, payroll slips, etc. Next page. Just a note here, there are time limits on each page. You'll receive a warning after 25 minutes. You can extend that time, but after the third warning, your time will run out and your work on the last page will be lost and your session will end. You can save and exit once you get a re-entry number and use that number to return to the application. Next, you will just enter the requested information on this page. And you would answer as if you were the applicant. Here, you'll enter the requested information. If the beneficiary's assets exceed the maximum noted, they will be unable to complete the application because they don't qualify. So again, if the applicant has all their information available, you can click Apply Now to continue. Next page. If the counselor is completing the form, you should fill in this section with your name, address, and phone number and indicate that you're from SHIP by entering Other for your relationship to the applicant and then SHIP in the next box. You can use the office address, and if you don't want to use your personal phone number, you can get a Google Voice number, or you can use my phone number. If the SSA or IRS calls me for information, I will call you. But more than likely, they will call the applicant for the information. We want you to indicate SHIP here because we want to get credit for helping the applicants. Next page. You fill in this section with the beneficiary's information. Their name, social security number, date of birth, have they worked, mailing address, etc. Next page. Here, after you enter the applicant's phone number and indicate their asset information, you can decide whether or not to send that information to the state of Michigan. If the beneficiary also wants to be assessed for MSP, which is QMB, SLMB, or LMB, these are Medicaid programs offered from the state of Michigan. So you would not check that box at the bottom if they want to be assessed. And you can check their qualifications by using the purple paper that you can get on SHIP Tools to see if they might be eligible for the Medicare Savings Program. Next page. Here you will see the reentry number. You would save that reentry number by either printing it or saving it as a PDF. You can use the beneficiary's social security number and the reentry number to return to a saved application. And on the next page, you'll see the reentry instructions. And it also gives you the last date that you can complete this particular application. Here it's listed as September 13th, 2021. Next page. If the beneficiary lives alone and has no dependents, you would enter a 0 in this box. If they have dependents, as defined by the IRS, you would enter the appropriate number, not including the applicant. Next page, you would enter the information as requested about bank accounts, stocks, bonds, mutual funds, IRAs, cash at home, money from other sources, and then other assets other than their home and property. Next page. Here you would enter information about income other than wages and earnings. If the applicant doesn't know the gross amount of their Social Security income, you can create an SSA account for them and look up the information in their in the beneficiary Social Security details. They also want to know if they receive any railroad retirement benefits or veterans benefits, and then you will enter those amounts if you say yes. Next page. Here you will enter the information as requested. If the beneficiary doesn't know the exact amount of their benefit, they can provide their best estimate. So they'll ask about, have you worked? Do you expect wages this year? What do you expect the wages to be? Etc. Answer as best they can. Next page. So if you've entered all the information, you'll see this review page, and the next few slides will summarize the data entered. You can change the information by clicking on the edit box in each section. So on this page, information about the form completer as well as the applicant. Next page. You'll see more information. Again, if anything is incorrect, you can edit it and change it and continue. Review and edit as needed. Next page. Here you'll see information about resources, income, wages, and earnings. Review and edit as needed. Next page. Again, review and edit. And then if you're ready to submit, you'll see a terms of agreement section. You, as well as the applicant, will have to agree to the terms of agreement. You'll see the check boxes on the next page. And once you click both of those boxes, you can submit the application. Once you submit the application, next page, you'll see this, which is the application confirmation page. This page should be printed, saved, and given to the applicant as well as your site coordinator. We as site coordinators will submit it to Lansing and we'll get reimbursement for every application that we have assisted with. So that is the end of my presentation. We will continue with Bev.
Good afternoon, everyone. It is my turn to talk in this presentation, and I am going to talk about LI-NET. That's something that everybody's heard a little bit about, but we're going to go into it in relative depth today. Not a long presentation, but a lot of detail. So what exactly is LI-NET? LI-NET is the limited income newly eligible transition, which is the NET part of that program. It is available to ensure that individuals who qualify for Medicare's low-income subsidy, LIS, which you just learned about, who are not yet enrolled in a Part D prescription drug plan, are still able to obtain immediate prescription drug coverage. So it's literally a safety net for folks who have not yet enrolled in Part D, but who are eligible for LIS. So this program is administered by Humana on behalf of CMS, the Centers for Medicare and Medicaid Services. And coverage in a LI-NET program, this safety net program, typically lasts for 1 to 2 months. LI-NET can also provide retroactive coverage for new dual eligibles, folks who are eligible for both Medicare and Medicaid, or for folks who are Medicare and supplemental security income eligible. Medicare automatically enrolls these individuals into LI-NET with an effective date retroactive to the start of their full benefit dual status or their last enrollment in a Part D plan, whichever one is most recent. These individuals are covered by the program temporarily while Medicare enrolls them into a standard Medicare Part D plan for the future. Now, that is the piece of LI-NET that makes it something that we do not see very often, because the vast majority of people who are fully dual eligible are automatically enrolled in LI-NET until they have an enrollment in Part D, until Medicare enrolls them in a Part D, because they are fully dual eligible. Next screen. Okay, LI-NET eligibility. Medicare beneficiaries are eligible for LI-NET if it needs to be two things: are eligible for LI-NET or extra help. Now, this includes full dual eligible folks, those who are eligible for extra help because they receive Medicaid or SSI, partial dual eligibles, those who receive a Medicare Savings Program or MSP plan, and individuals who have applied for extra help through Social Security and have received their notice of award letter. So it needs to be one of those things, and they are not yet enrolled in a Part D plan, or they do not have prescription drug coverage through a Medicare Advantage plan. So how are beneficiaries enrolled in LI-NET? Most fully dual eligible beneficiaries are enrolled into the LI-NET program through Medicare's auto enrollment process. This process occurs when Medicare identifies a beneficiary who is not yet enrolled in a Part D plan, but does qualify for the low-income subsidy, Medicaid, full Medicaid, or supplemental security income, SSI. When these individuals are identified, Medicare automatically enrolls them into the LI-NET safety net program. Now, beneficiaries who are not enrolled automatically by Medicare can be enrolled at the pharmacy counter. The pharmacy submits a claim to LI-NET, and if the beneficiary is eligible, the claim will process immediately, and the enrollment into the LI-NET program is also created so that the beneficiary can have their prescriptions filled at the pharmacy counter. Now, at either of these points, the beneficiary needs to choose and enroll in a Part D plan to ensure that they have prescription drug coverage once their LI-NET coverage ends. This is the time to encourage the beneficiary to take a look at Part D plans. Beneficiaries who were not enrolled via the auto enrollment or pharmacy counter processes can also submit claims for reimbursement for eligible retroactive periods. Next slide. So how can we help beneficiaries? Fully dual eligible individuals are automatically enrolled in LI-NET. They will receive a letter from CMS. It's on purple paper, and it indicates that they are eligible for extra help and have opted into LI-NET. Partially dual eligible individuals and those who applied directly for extra help rather than being auto-enrolled must enroll in the LI-NET program at the pharmacy. These beneficiaries must provide best available evidence to pharmacy staff for immediate prescription fills and LI-NET enrollment. This best available evidence includes one of the following documents: a copy of the beneficiary's Medicaid card that includes the beneficiary's name and an eligibility date. That eligibility must be in effect after June of the previous calendar year. Or proof from the state that confirms active Medicaid status in effect between July 1 and December 31 of the previous calendar year. Or a letter from the Social Security Administration showing that the individual does receive SSI, so supplemental security income. Or a letter from Social Security or CMS indicating that extra help, LIS, has been awarded, either an official award letter, a notice of change into LIS or extra help, or notice of planned action to be enrolled. Little bit of detail about enrolling at the pharmacy. If the pharmacy is not aware of the LI-NET program, there is a 4-step process that a pharmacist needs to follow. While partially dual eligible individuals and those who have applied directly for extra help must enroll in the LI-NET program at the pharmacy, not all pharmacists or pharmacy staff are aware of LI-NET. This 4-step process can be found in the Limited Income Net Program 4 Steps for Pharmacists document on ShipTools. Humana has also created a tip sheet for pharmacists to help beneficiaries access LI-NET. Those are 2 really strong resources for you. If you should run into a beneficiary who finds themselves at the pharmacy counter, they are not yet enrolled in a Part D plan, they have been awarded LIS or extra help, and they're trying to get their prescriptions filled. Now that might give you a sense of how rare this comes up. Very often, most frequently, they are automatically enrolled in LI-NET, and this is seamless. But if it's not seamless and you run into a beneficiary, educating the pharmacy about LI-NET on behalf of the beneficiary is a time-consuming process, and it's really complicated. It is something that we can help with. But if you've helped a beneficiary this far along and you run into a roadblock when you hit the pharmacy, don't hesitate to contact your site coordinator to help you get through this particular at the pharmacy counter step. So, a quick review. Beneficiary must be eligible for Medicare Part D and Medicaid, LIS extra help, or SSI. LI-NET provides immediate prescription drug coverage at the pharmacy counter. There are limited pharmacy network restrictions to LI-NET. There are no premiums, and the copays are based on the LIS parameters that we just discussed in the previous presentation. Coverage usually lasts about 2 months, and this is when the beneficiary needs to go ahead and apply for that Part D. They should be very aware that they don't yet have a Part D plan, because that's why they need to apply for LI-NET. And do keep in mind that retroactive reimbursement may be available for out-of-pocket expenses that the beneficiary has incurred prior to enrollment in LI-NET. So there are plenty of places that you can get further information on LI-NET. Certainly, your site coordinator would be a main resource for that. But if this is something that you'd like to be prepared to know a little bit more about, ShipTools has all the information that you need to help a beneficiary enroll in LI-NET. There's a fact sheet for team members. There's a program brochure that's actually about the LI-NET program. There's a Q&A form. There's a fact sheet for beneficiaries, which I included in the handouts for you to download. There's a beneficiary reimbursement form for those expenses that were incurred prior to LI-NET enrollment, and a fact sheet on the reimbursement for out-of-pocket costs. Additional information on LI-NET is also available from the CMS website. And if you take a look at the Humana website and search for LI-NET, additional resources are there, including a detailed list of frequently asked questions. It's a little bit difficult to navigate that Humana website, so that would sort of be something you'd look at if you really want to dig deep into information on LI-NET. You should be able to find what you need from ShipTools or from the CMS website. And LI-NET does also have a customer care team. This is the number that beneficiaries can call to get complete information on enrollment, disenrollment, or other LI-NET issues. So that is the end of my presentation. The thing that I wanted to stress is that it doesn't come up very often, but when it does come up that we need to help a beneficiary, it can be quite a detailed process, and that's what your site coordinators are here for. So we can help you out with that if you need it.
All right, so I've stopped sharing my screen so that we can tackle some questions here. And in our question box, we have the question, when a beneficiary is approved for LIS, how long does it take for Medicare's website to show the LIS benefit? That is a great question that we would love to find the answer out for you, unless Bev or Loretta, you happen to know that. From my experience, I think it takes at least a couple of weeks. I think it's dependent upon communication between Social Security and CMS, but I would love to find that answer out for you guys and get back with you on it.
I don't know.
Okay. So we'll find that answer and we'll get back to you guys on it. That is all for the typed in questions. Let's see if we've got any hands raised for any questions. I am not seeing any. Miriam Green, I think we answered your question by telling you we're going to find that out. Okay. All right. Well, if nobody else has any other questions, I will.
That's great. Our whole team completely understands LIS, extra help, how to apply, and how to help someone get LI-NET. That's wonderful.
Yeah.
I also want, can I just add a note here that if the information on LIS is not available to the applicant, you can always call 1-800-MEDICARE or use your unique ID and call Medicare, and they should have the information.
Excellent. Well, what I'm going to do is I'm going to stop recording the presentation in case anybody has questions and they didn't want to ask during the recording. And then otherwise, if there's no questions after that point, we'll bid you adieu for the day.